How often do breast cancer screenings show false positives? Imagine going in for a routine mammogram and being told to come back for more tests, only to find out later there was no cancer. That's what a false positive result is. It happens when a mammogram shows something suspicious, but further testing reveals it's not cancer. This is a common part of breast cancer screening, and understanding it can help women feel more prepared and less anxious. A false positive mammogram occurs when a radiologist spots something on the initial image that looks like it could be cancer, but additional imaging or a biopsy shows no cancer is present. Radiologists aim to catch even tiny changes that might be early signs of cancer, but sometimes normal breast tissue can look similar to cancer on a mammogram. This is why extra tests are often needed to clarify the findings. In terms of how often this happens, about 10 to 12% of women will have a false positive result from a single mammogram. The chance is higher in younger women and those with dense breast tissue, which can make interpretation more challenging. If a woman has annual mammograms over 10 years, more than half, around 50 to 61%, will likely experience at least one false positive. If screening is done every 2 years instead of every year, the risk drops to about 42%. So, the frequency of screening influences the likelihood of false alarms. When women are called back for additional tests, most do not have cancer. They might undergo diagnostic mammograms, ultrasounds, or even biopsies, but these usually come back negative. While these follow-ups can cause worry and inconvenience, they are important steps to ensure nothing is missed. It's also worth noting that false positives can lead to some women feeling hesitant about future screenings, but regular screening remains crucial for early detection. Research shows that women who experience a false positive mammogram are slightly more likely to be diagnosed with breast cancer later on. This doesn't mean the false positive caused cancer, but it could be because some benign changes share features with early cancer. However, the overall risk increase is small, and most women with false positives will never develop the disease. It's important to remember that false positives are a known part of the screening process. They highlight that the test is sensitive enough to detect subtle changes. The benefits of catching cancer early generally outweigh the risks of false alarms. Women should continue regular screenings as recommended by their healthcare providers, even after a false positive result. If you're called back for more tests, try not to panic. Most of the time, it's just a precaution, not a sign of cancer. To sum up, about 10 to 12% of women will have a false positive from a single mammogram. Over 10 years of yearly screening, more than half will experience at least one. Most follow-up tests show no cancer, but false positives can cause anxiety and might make some women skip future screenings. Women with a history of false positives have a slightly higher chance of future breast cancer, but the majority will never develop it. Always discuss your screening schedule and concerns with your healthcare provider to make the best choices for your health. Remember, breast cancer screening saves lives by catching cancer early, and understanding the chances of false positives helps you stay informed and confident in your health decisions.